For orthodontic treatment, like any other type of medical or dental procedure, there are certain risks and complications to consider before you start your treatment. Your orthodontist may also provide you information specific to the type of braces that you may be having, as this varies from patient to patient. This video is to help provide you sufficient information for an informed decision to be made before you start on your treatment. Please don't hesitate to ask your orthodontist if you have any additional questions. Having good brushing and diet is very important throughout your treatment. Poor brushing can cause swelling of the gums, bleeding of the gums, which are all signs of early gum disease. Having a good diet is also very important. By consuming too much sugary food, sugary snacks, fizzy drinks and sweets, you can leave permanent staining on the teeth that can never be removed. When the brace is tight around the teeth, this can cause a bit of discomfort. It is not to an extent that you need to worry about, but if it causes you any discomfort, you can use some painkillers such as paracetamol to help you through those initial stages. In some cases, we see that the tooth can die or undergo loss of vitality. This is a rare circumstance, and it's usually associated with teeth that have had a history of past injury or trauma to them. It can also be associated with teeth that have large existing fillings. Some of the larger crowns and fillings may become dislodged when it comes to the stage of having your braces removed. Now, we will take our best care for this not to happen, but if it does, in these instances, the replacement may be required at your own expense. For any type of orthodontic treatment, the roots of the teeth tend to get shorter by 1 millimeter to 1.5 millimeters. Now, this is rarely to an extent that you would notice or would affect the longevity of the tooth, but on very, very rare occasions, for example, when the tooth has had a previous injury, or in some cases for an unknown reason, the roots of the teeth get shortened by more than this amount, and this can lead to their early loss. Throughout the treatment, we need good cooperation. The orthodontist can only do their best to give you a nice outcome, but also you need to play your part in terms of the diet and brushing, but as well coming to your appointments regularly, keeping your appointments, and minimizing the number of breakages that you have. We would also kindly ask you if you can let us know of any cancelled appointment, ideally 48 hours in advance, so we can arrange for other patients to be booked in. For any lab-made appliances, including retainers, there will be additional charges even on the NHS if the appliance is lost or broken. We do not recommend any patient to have their wisdom teeth removed. It used to be thought that development of wisdom teeth later in life can cause teeth to become crowded again. Now, through research, this has been proven not to be the case. Only on some occasions, your dentist may recommend for your wisdom teeth to be removed. For example, where there has been more than 2 separate occasions of infection requiring antibiotic therapy. There is also no evidence that orthodontic treatment can help improve or alleviate any jaw joint problems. Now, for most patients, orthodontic treatment can be carried out successfully, giving a beautiful smile, but on some occasions, patients may grow in an unpredictable manner. For example, this is particularly relevant for patients that have a prominent lower jaw or where they have an open bite. In these cases, we can straighten out the teeth, but we cannot change the way the jaw is genetically programmed to grow. For complete correction of the bite, you may wish for us to refer you to the hospital for comprehensive correction using braces and jaw surgery. Once your orthodontic treatment is complete, we provide all the patients with a set of retainers which can be removable and in some cases fixed retainers. Wearing the retainers is a lifelong process. Initially, your orthodontist will supervise wearing of your retainers for a year, but following that period, it will be up to you to carry on wearing them throughout life. With the removable retainers, you can place them in and take them out. With the fixed retainer, they are cemented on the teeth, so it's less relying on you remembering to wear them. However, both types of retainer need regular care and maintenance. If at any stage your retainers are lost or broken, you can visit us if you live in the area, or you can visit a local orthodontist, dentist if you live in other parts of the country. The information that I've been through so far is just to highlight some possible rare complications and risks, but keep in mind also orthodontic treatment can have a lot of benefits. Having a good smile can boost confidence, it can reduce the risk of injury to the teeth, and can also improve the function of bite when it comes to chewing food. I hope this is a journey that you decide to start with us, and we look forward to having you as one of our patients in the clinic.